I recognize the Leader of His Majesty's Loyal Opposition.
Thank you, Speaker, and I will take 1 second as a member of the class of 2006 to welcome back the member for Nepean. Welcome back, sister. Courage. Courage. Speaker, since the beginning of this year, Ontario's ERs have been closed more than 100 times. Those closures are happening in rural areas, places like Chesley. Their ER is closed until the end of November because of a shortage of nurses. Just a few weeks ago, most of Chesley's residents packed into a meeting to fight for their community hospital. This government has left Ontarians with no credible plan of action to address the crisis in our healthcare system. For the Premier, why has the Minister of Health neglected her duty during this difficult period?
Assistant Minister of Health.
Thank you, Speaker. After decades of underfunding, this government has made unprecedented investments in our healthcare system. Healthcare funding has increased 6.2% year over year, the largest increase on record, including an over $5 billion in base funding, which is an 8.9% increase. No previous government has increased base funding by such a high amount year over year. We have added over 3,500 new hospital beds, and we are adding an additional 3,000. We're in the process of building and upgrading 58,000 long-term care beds. And we've got a $40 billion investment in 52 new hospitals and additions, and $1 billion for home and community care expansions. We're investing in our healthcare system. We're going to make sure that Ontarians have the resources that they need in hospitals and other healthcare facilities, so Ontarians get the care that they deserve.
The supplementary question.
Well, Speaker, I hear the announcements, but I don't see the results. There are consequences when health care isn't there when people need it. Recently, Eleanor wrote to me about the passing of her daughter, Amelia. Amelia was diagnosed with stage 4 breast cancer, and she was diagnosed late, with her screening pushed from November to February. By then, her cancer was so advanced, the only thing doctors could do was palliative chemotherapy. Eleanor's a retired nurse. She knew that Amelia's diagnosis was likely fatal. But with earlier screening and better access to care, Eleanor believes Amelia would have lived more than the 5 short months from diagnosis. Speaker, these are real-life impacts of the government's inaction on health care. Will the Premier and Minister commit to meaningfully invest in our health care workers so there are no more stories like Amelia's?
Respond. Member for Eglinton Lawrence.
Thank you very much. Well, if you want to talk about real results, I just want to mention that the College of Nurses of Ontario has registered more nurses because of programs that we've put in place in 1 year than ever in history, a record 12,800 new nurses have been registered, and there's still 2 months left to go this year. So that is an improvement, a record improvement. Our government has been focused on ensuring that Ontarians have the care that they need where they need it, and Ontario Health Cancer Care Ontario is the government's advisor on cancer and renal system and flows more than $2 billion to hospitals to support direct patient care every year. We're working very hard with Ontario Health, which oversees our overall cancer strategy, to make sure that we have the critical programs that we need and the services we need to make sure that Ontarians like Amelia get the care that they need in a timely way. Thank you.
And the final supplementary.
Thank you. Again, I hear the announcements. People don't see the results. In September, a 4-year-old child with a broken arm was left waiting more than 4 days for minor surgery at McMaster Children's Hospital. These types of delays can have dramatic impacts on growing kids. Speaker, these tragic stories are driven by staffing shortages that are now commonplace. How much worse does the crisis in our healthcare system have to get before the Minister and the Premier give nurses and frontline healthcare workers the support that they need?
Member for Eglinton Lawrence.
Thank you, Mr. Speaker, and thank you to the member opposite. Nothing is more important than protecting the health and well-being of Ontarians, especially our children. And I saw the interview with the mother. I understand that the young man had to wait a few days for an operation on his elbow, which is not fair, and we would like to change that and make sure that it doesn't happen again. However, the mother did say in the interview that once the child got care, the care provided was exceptional, and that the child is now recovering. Certainly, we're making significant investments to address the province's surgical backlog, and we've also dedicated $6.5 million to pediatric hospitals to support them to ramp up the surgeries. And we've also provided $4.6 million more funding for hospitals to add additional acute care beds, 9 at CHEO, and 10 acute care beds there as well, and 3 ICU beds at Sick Children's Hospital. Thank you.